The cardiovascular system and venous return. The cardiovascular system serves important functions during exercise. It delivers oxygen to working muscles, oxygenates blood by returning it to the lungs, transports heat from the core to the skin, delivers nutrients and fuel to active tissues, and transports hormones. In this presentation, I'll be focusing on hemodynamics, the dynamics of blood flow, particularly focusing on venous return, discovering the path and processes in which deoxygenated blood returns back to the heart from the capillary beds to be reoxygenated and returned back to working muscles. How does blood flow back to the heart? The blood returning back to the heart is lacking oxygen, hence why it is returning to the heart to be reoxygenated by the lungs and be redistributed to working muscles. Throughout the body, capillaries function as part of a capillary bed, a network of 10 to 100 capillaries. The blood flows from capillary beds into post-capillary venules, then into muscular venules that drain the capillary blood and begin the return flow of blood back towards the heart. Blood then passes from venules into veins, which contain one-way valves, which project into the lumen and point towards the heart. These valves aid in venous return by preventing backflow. When muscles contract, valves open to pump blood to the heart, and when muscles relax, valves close to prevent backflow. Gravity pushes blood down, so the blood flow back to the heart has to fight gravity, except when coming from the head. This all depends on pressure differences between venules and the right ventricle. There are two major methods which promote venous return. They are the skeletal muscle pump and the respiratory pump. A major mechanism promoting venous return during normal activity, for example walking or running, is the muscle pump system. Peripheral veins, particularly in the legs and arms, have one-way valves that direct flow away from the limb and towards the heart, which we spoke about in the earlier slides. Veins physically located within large muscle groups undergo compression as the muscles surrounding them contract, and they become decompressed as the muscles relax. Therefore, with normal cycles of contraction and relaxation, the veins are alternately compressed and decompressed. As we can gather with exercise, the skeletal muscle pump increases its actions, therefore increasing venous return. As you can see with the diagram, muscle contraction propels blood forward through open distal valves and impedes flow into the muscle as the proximal valves close during contraction. The venous valves prevent the blood flow from flowing backwards, thereby permitting unidirectional flow that enhances venous return. The respiratory pump is also based on alternating compression and decompression of veins. During inhalation, the diaphragm moves downward, which causes a decrease in pressure in the thoracic cavity and an increase in pressure in the abdominal cavity. This results in abdominal veins being compressed and a greater volume of blood moving from the compressed abdominal veins into the decompressed thoracic veins and then into the right atrium. Pressure is reversed during exhalation, and the valves in the veins prevent backflow of blood from the thoracic veins to the abdominal veins. Exercise increases respiratory rate, which in turn increases venous return because of a decrease in right atrial pressure, and therefore increases the return of deoxygenated blood returning back to the heart to be reoxygenated. Therefore, exercise increases venous return.